Now to lung cancer with Dr. Zimmermann from Fribourg, Switzerland.
Well, it seems that events like the ESMO truly shape the way we think about cancer care. And among all professionals involved in lung cancer treatment, who would have thought 10 years ago that one day immunotherapy or targeted drugs would one day challenge conventional treatment in all lines of therapy. And yet this is really becoming a reality very soon, later this year or at the beginning of 2015, we're expecting the first phase 3 randomized trials of immune checkpoint inhibitors reporting their first results. So this is just the final step before there is filing for regulatory approval and these drugs reach the clinic everywhere. So in this regard, I would like to mention one nivolumab trial, I think the Checkmate 57 trial in second line non-small cell lung cancer, the non-squamous subtype, which will probably report first. It will be closely followed by a pembrolizumab trial, again in second-line non-small cell lung cancer. And these two trials should again be followed by two important and eagerly awaited ipilimumab trials, both in combination with chemotherapy, one in extensive disease small cell lung cancer and one in squamous non-small cell lung cancer, both in first-line therapy. And this is just the beginning because this is paving the way for use of immunotherapy in earlier stages of lung cancer. This is something we've been waiting for a very long time. We've seen the launching of the Pacific trial, which is using immunotherapy as a consolidation after radiochemotherapy in stage 3B disease, and trials of adjuvant immunotherapy are in preparation. So this is for immunotherapy. This Congress was themed Precision Medicine and Cancer Care, and while this is already a reality for our EGFR mutated patients and ALK rearranged patients, there's other oncogenic driven subgroups that have seen much less tangible results in recent years, and this is again changing. I would like to mention the progresses, the wonderful progresses actually we've seen in the subtypes of BRAF mutated tumors, also HER2 mutated tumors, RET and ROS1 rearranged tumors, where there are drugs that we know from other disease types, drugs that we know now that they work, that they have an activity in lung cancer, and are just waiting for an appropriate pivotal trial before they reach the clinic. And I'm particularly enthusiastic of all the efforts that are being put into addressing the very, very challenging subtype of KRAS mutated tumors. We're seeing trials with MEK inhibitors and cyclin-dependent kinase inhibitors, among others, that will really help us in this area of dire need of better treatment. And lastly, I would like to also emphasize the fantastic opportunities that we're seeing thanks to the knowledge that we have acquired in how our cancer patients become resistant to our initial therapies. And in this regard, you really have to stay tuned to third-generation EGFR inhibitors and second and third generation ALK inhibitors that are in development and will further postpone chemotherapy in these patients, though a true clinical benefit to be expected there. I could actually go on and on about what's exciting. I want to thank you very much for covering the event. I truly hope that your days in Madrid have been as exciting as mine. Thank you.
Thanks, Stefan. And last but not least, we